balancing the budget. So I have three priorities. So the first one is we need a balanced budget. We need a balanced budget in 2013, not a balanced budget in 30 years or 40 years, like the Paul Ryan plan. Republicans are like, oh, we need a balanced budget. They're full of it. They're not going to balance the budget anytime soon. They're just going to keep spending like they have been spending. So balance the budget, end the wars. We need to bring the troops home. That's all the wars, every place we're at. We need to cut the budget 43%. And to cut the budget 43%, we need to look at all the programs, and that's social programs, and that's military too. So if we cut the military spending by 43%, which is what would be needed to balance the budget, that would take us all the way back to 2003 levels. So I think we were safe enough in 2003 that we probably can figure out a way to cut 43% out of the military budget to get to a balanced budget so that we don't have a collapsed economy. Because if our economy collapses, or we hit hyperinflation or just superinflation, then we're not going to be able to even afford to take care of the people that need taken care of, whether that's Medicare, Medicaid, Social Security. We need to take care of the problem of the budget right now.
Great. Okay. And what is your preferred tax policy?
Okay. Well, our current tax policy sucks. I'm a small business owner. It's costly, it's complicated, and it's corrupt. It's costly because it costs taxpayers anywhere between $300 billion and $600 billion every year just in compliance costs. So that's paying for your tax software, your accountant, all the time you spend filling out your 10W40, your 1040 form. And even the IRS agents don't know what's involved in the tax code. If you call them up, you have a 50-50 chance of getting the wrong answer. So it's definitely costly. It's complicated because the IRS agents don't even know what's in it for the most part. It's 70,000 pages of tax code and regulations. And it started out as only 100 pages, so we need to simplify the tax code. And corrupt. We have hundreds or thousands of lobbyists per each congressional candidate down in DC to focus on the tax code. And they're trying to get every single loophole they can get in for big corporations, for special interests, and that's something else that we need to get rid of. So my solution is we need to overhaul the entire federal tax system, and that's payroll tax, personal income tax, corporate tax, dividends tax, estate tax, death tax, even the tariffs. And I would like to see a single national consumption tax, which one of the plans that's proposed out there right now is called the Fair Tax, and you can go to fairtax.org to learn more about it. And it's a simple consumption tax, which is about 120 pages total, and it becomes one tax. It makes it a lot easier to comply with, and it's only a tax on the end goods, so any services or goods, that's the only time it gets taxed, so we get rid of double taxation also. So if you go to the store, you buy that $1 bottle of water, right now there's about 23 cents out of the dollar of hidden taxes in it. That's part of that payroll taxes and corporate taxes that they just shove into it. You don't even see it. So the other thing, really nice thing the Fair Tax does is it makes all these taxes transparent. And as one tax, it's simpler, but it makes these hidden taxes transparent so everyone can see how much their government's costing them. And they're going to be shocked because it costs a lot, and it's in the price of every single good.
And what is your position on the Patient Protection Affordable Care Act?
Obamacare?
Obamacare.
Okay.
Otherwise known as.
Otherwise known as. Obamacare, we couldn't afford it. I think it gives out, it's really something that insurance companies put together because they're benefiting greatly from Obamacare because now they have about 40 million new people that will have to get insurance, and basically it goes to the insurance companies. But beyond that, it's more than just being against the Obamacare because I think it shouldn't be done at the federal level, it should be done at the state level. Secondly, you go back just 6 years ago, Bush passed the largest entitlement program in history with his prescription drug plan. So we have both Obamacare by the Democrats, Bush Care or Bush's prescription drug care by the Republicans, and two huge entitlement programs, neither of which we can afford, which is one of the reasons why we've gone from about an $8 trillion debt. Part of that, all that debt, that $16 trillion, is including all these new entitlement programs. Now, as far as getting to the core of the issue is how do you make healthcare cheaper, more expensive, so everyone can afford it themselves. There's lots of different ways to do it. So I would like to see, and like I said, get it back to the state level, let the states figure it out. So we can have New Hampshire, we can have Vermont. So if you want a single payer system, do it at the state level. Vermont could have a single payer system. New Hampshire might want a more free market system where you can buy insurance from across state lines at half the price we're currently paying, or you might be able to get your prescription drugs online from Canada or Europe. So there's lots of different ways to make it cheaper. Again, and transparency is a big thing. Doctors don't know how much things cost. So if you go to your doctor, they're like, oh, you need a CAT scan. You can go to Concord or Keene, the hospital there, to try to get a CAT scan, but it might be like $4,800, which is how much it cost my wife to get the CAT scan last time she did it. But if you were to call around the state, there's a place in either Nashville or Salem that's doing the same CAT scan for like 500 bucks. So it's definitely one of those things, if consumers know how much things cost, they can shop around, and we take, having the insurance companies part of this, whether it's the government or the insurance companies, it's putting a middleman in there that gets rid of that, the hurt, I guess you can call it, of, you know, or the price, the shock of the sticker or the price tag for these different things. You shop around for an oil change, you would shop around a little bit more for health insurance if we let states have more ability in that way.
Great, and what is your position on the USA Patriot Act?
Repeal it. So this is another issue I disagree with President Obama on. It should be repealed. We should never have passed it. They should have read the bill before they passed it. And the Patriot Act, the National Defense Authorization Act, these are both bills that need to be repealed. They infringe on our civil liberties without doing a damn thing to, you know, protect us. You know, after 9/11, you had to secure the cockpit doors of the planes. That would prevent any new 9/11. We don't need, I don't even know how many pages, 4,000 pages, 6,000 pages, the Patriot Act, and you know, we don't need it. So the Patriot Act should be repealed. And another reason why I can't vote for Obama again this time, because he reauthorized the Patriot Act.
Great, now we'll open it up to questions from the audience.
Ron Paul seems to be the leader of the libertarians. One of the things that Ron Paul was against is he's against abortion. I would like to know how it's being against abortion is libertarian.
Please.
I'm pro-choice, so you'll have to talk to Ron Paul about that one. I can kind of give you the debate, because libertarians are split on the abortion issue, just like the majority of the population is. Gary Johnson, our candidate for president, he's pro-choice. His take on is viability of the fetus is when you're no longer allowed to abort a fetus. So that's, you know, second trimester or something. You know, you can abort in the first trimester or something like that. And that's, you know, it's, libertarians are typically pro-choice 100% of the time on everything. Ron Paul's take on it is that he thinks life begins at conception. I think it begins someplace else that's kind of foggy. And also, I mean, I think if the government starts outlawing abortions again, then guys will start having abortions. I mean, it's just how the government works. It's not going to work. People are going to go out and seek abortions. However they do it, they'll just be illegal. And then we get into a health and safety issue for the women trying to get the abortion. So I think we should keep it legal, keep it safe, and leave it up to the woman. And it should be really between the woman and their doctor. Politicians should stay out of it.
Go ahead.
Yeah, insurance companies keep 30% of what you send them. And the other reason it's so high is us who are insured pay for those who aren't insured. When we're already treating 100% of us, why should changing the insurance way up the price?
Okay, so to repeat the question, insurance companies are already keeping 30%, and why changing the way we do the insurance, would it increase the price?
Why, if we go to a single payer who, in Canada, the overhead is 4%. In this country, the insurance companies keep 30%. And I don't know what the last insurance company did for you, but I've never even had my temperature taken by an insurance company who keeps 30 cents out of every dollar I send them.
Well, I have catastrophic insurance, so I pay, well, I started paying about 120 bucks a month. It's gone up to, I think I'm paying $200 a month now.
Mm-hmm.
And there's a $5,000 deductible with it, and there is I also have a health
And where
savings
does the
account.
average guy get the $5,000?
Well, you don't use it unless you need it. So for most people, I haven't needed it since I started my insurance when I was, out of college and I started buying my.
And your
I-
employees could come up with $5,000 if they get sick?
That's a deductible, so they pay
Right.
part of it. So the other part of it is I have an HSA. So with a health savings account, each year I can put in up to $2,000. And lots of companies match that HSA.
You're not an average guy, income-wise.
Check to check.
Well,
I'm talking about the
yeah.
average guy who works for the minimum wage at
Uh-huh.
Walmart
Okay,
with
Walmart
no
is-
benefits.
Well, my sister-in-law works at Walmart and she gets benefits. So it depends on
She's
who.
a low-wage worker?
She's probably middle.
Well, not the,
She doesn't work, she's not a cashier. But anyway, back to your question. So, how's my health insurance company helping me? I have a $5,000 deductible. I haven't had to pay it. I put money into my health savings account to save up for, needs. But that's only because health insurance has been so much. When I started out, it was only $80, $80 a month, and a $2,500 deductible. But we have governments putting in different regulations like, oh, now my insurance company sent me a letter saying, oh, we have to raise your deductible because now we have to cover you for pregnancy. Well, I'm never going to get pregnant. I'm a guy. So, but where my health insurance company, I like my health insurance company, is I just came down with Hodgkin's lymphoma 6 weeks ago. So now I have cancer, starting chemo. And so I've hit my 5,000, and they will put you on a payment plan that hospitals will to help you pay for it if you can't afford it out of pocket. So there are ways to get around it, and the hospitals will also help you out there also. Ms. Tilton?
I'm just wondering, where do you think the hospitals get the money? I mean,
And-
somebody is paying that bill.
Yes, someone is paying that bill.
It's people who have health insurance and their insurance premiums are high in order for the hospital to be able to skim off money to pay for the uninsured.
Yeah.
If everybody's insured, one hopes that, the costs go down
You would
to
hope.
everybody.
they'll go earlier before they're in desperate.
They could, they might not, or they might go, or they might all go earlier and go for every single cold that you get. But that's, and they go to,
No.
well, hey, my wife has been going to the ER like every other day because her doctor says, oh, go to the ER for whatever it is because that's the way that they're sending her right now.
'Cause
And
she
she's
has-
on Medicaid.
Because she has no insurance.
She's on Medicaid. She has insurance, and they keep sending her to the ER. So if this current system's broken. I mean, I think you can all agree the current system's broken. It's the way, how do we get it fixed? Single payer might work, and I'm saying I'm okay with single payer. Make it to state level, leave it don't do it at the federal level, because that way we have 50 laboratories of innovation trying to figure out what might work best. And a single payer might be it, and it might be a mixture of single
Works
payer.
in every other modern country in the world.
Yeah, we can debate that too, because there's lots of, that's also for debate. It works in lots of countries, but you're also on a waiting list in England,
Okay, that's time.
Okay?
Thank you very much.
Been 3 years.